think the thing that sets Queen's Drive out from maybe a lot of the other practices that you'll see is that, you know, we are still a kind of cutting edge private practice. We're doing lots of different types of treatments, but at the same time, we've still kind of got our kind of soul as a really long-standing sort of family dental practice. We've been here for over 100 years. A lot of our patients, you know, they've been coming for their whole lives. A lot of my patients know each other. We kind of get to know our patients really well. And you know, even after we've seen patients, we've finished their treatment, you know, we tend to like to keep them on if possible and keep looking after them. And it is really nice because I get to know a lot of my patients, a lot of our patients get to know us, and you really kind of build that trust. You're not seeing someone different every time you're in. You really will kind of get a bit of a trust and a bond with your own personal clinician. I think that's really important because you'll be growing up, you know, you'll be used to having that same dentist you've had, and a lot of times in the modern world now maybe it isn't quite the same. It feels a lot more corporate, but I really do think we've kind of kept our family core. I mean, our team, a lot of the clinicians, we've all been here for sort of 5+ years. We all work together really well. So yeah, I think the feel of the practice is still really friendly, you know, kind of family focused, which I don't think you always get as much anymore, but I do think that's still really crucial for us to be able to do the best kind of treatment possible. So, you know, within kind of the Pain Free Dental Group and within Queen's Drive, it's really important for us that we're non-judgmental with patients, and what that means is that we totally get it. You've probably maybe not been to the dentist in 10 years, maybe more. You're going to think that we're going to judge you, we're going to see things that we're shocked by. It's not the case, you know. We know how phobias work, and the natural thing to do is to avoid coming in. You know, it takes one bad experience to put you off for life. So you just need to know that when you come here, you know, all we want to do is help. We want to get to know you first. We want to talk to you. A lot of times, the first time I see a patient, we'll maybe just sat and talk for 20 minutes before you even look in your mouth. We want to get to know maybe why you're nervous, exactly what we can do to help you before we see you. And then from there, just chat through it and then really work on a way to get you the best possible smile. But at the same time, like I said, we'll never ever judge anyone for having problems with their teeth. And to be fair, a lot of the time, the hardest thing to do is to make the jump and come in for your first visit. We kind of, our motto is Pain Free Dentistry, and we deliver on that, I think. We have state-of-the-art technology, you know, digital injection systems. Take time, you know, we just work really gently on patients. You know, for really anxious patients, a lot of time we'll use sedation when needed, and that can work really well. But for me, it's just about, you know, doing things really slowly, really gently, letting the anaesthetic work, taking our time, and all these things really come together quite well. Another thing we talk about is dentistry for busy people. So we know that, you know, not everyone can come in on a Monday at 11 o'clock. You know, we all work late nights, we all work Saturdays, we work around the clock to make sure that the practice is open as much as possible for patients to come in. We also know that for a lot of patients, you know, they've maybe got a deadline, you know, there's a wedding coming up, there's a big birthday, a big holiday that, you know, you want that smile finished for. And what we try to do is, you know, we don't want to have our books filled up for months at a time. You know, you might find you'll go somewhere and they'll say, yeah, we can do it next October, but we try and really manage things to meet your own deadlines and then try and get treatments done sooner than later. And I think that's really useful when, you know, you're really keen to get something finished for something in particular. So I think for a lot of people coming in, you know, almost getting the first hurdle over with of getting their mouth healthy, it's always been a bit of a roadblock to them going on and maybe having the treatment that they want rather than just need. So a big part of what I feel I do is kind of help you overcome that anxiety, get you to a point where your mouth is healthy and stable and that you trust us. And then, you know, work alongside a full team of clinicians. I've got, you know, some excellent cosmetic work being done in the practice. I think it's really important that, you know, we're able to get patients to the point where they're able to go on and have that work done. And there's so many cases that, you know, I see patients that maybe would struggle to get a checkup or a fill-in that have then come in and, you know, ask me, can I get this done? Can I go on and maybe get composite bonding? Can I have those implants? Can I get the veneers? And without dealing with the first parts, I think it's really, you know, difficult to get there. So it's so crucial for us to be able to help you along that journey. But yeah, you know, some of the work being done in the practice, I think, is outstanding.